Welcome back to another deep dive. Today we're getting into a scenario that is honestly just quietly breaking the hearts and really the sanity of pet owners everywhere.
Oh, totally. It's an incredibly heavy topic.
Yeah, it is. Picture this for a second. You're the listener, right? It is 2 in the morning. You are utterly bone-deep exhausted, and your senior dog is just pacing the
It's
hallways.
relentlessly pacing.
Right, exactly. You hear that click, click, click of their nails on the hardwood floor. They're panting. They're staring at the walls, completely unsettled. And you are just sitting there feeling so helpless and, frankly, so sleep deprived.
It's a nightmare scenario for any owner, really.
It is. So today we are unpacking a clinical framework from veterinary behavior experts Dr. Julia Albright and Dr. Kevin Flaum. This was published back in July 2022, and it's focused entirely on managing this nocturnal anxiety in geriatric dogs.
And we should clarify, this isn't just a quick internet list of bedtime tricks.
No, definitely not. We are diving into the fascinating intersection of aging neurology, environmental psychology, and something far more profound about how we live with our pets.
Yeah, and we really need to establish right up front why this specific topic matters so much, because the stakes here are shockingly high.
They really are.
When a senior dog develops nighttime anxiety or these severe sleep-wake cycle disturbances, it becomes incredibly destructive to the entire household. I mean, it completely ruins the owner's sleep.
Which naturally leads to chronic exhaustion.
Exactly. Exhaustion, frustration. And because of that severe sleep deprivation, we often see a rapid, tragic deterioration of the bond between the human and their pet.
Which is heartbreaking because you've had this dog for maybe 10, 15 years.
Right. And devastatingly, this nocturnal pacing and anxiety is actually a very common reason for euthanasia in older dogs. So the goal of exploring these 5 clinical interventions today is quite literally to save that human-animal bond before it reaches a breaking point.
Okay, let's unpack this. Because as a pet owner, it is so incredibly easy to look at that old dog pacing the hallways at 2 a.m. and immediately assume, oh, it's doggy dementia.
Oh, yeah. That's the default assumption for almost everyone.
Right. You just figure, their brain is aging, they have canine cognitive dysfunction, and
Yeah.
there's nothing you can really do. But the clinical approach from our source actually starts with a massive, surprising checklist of hidden causes that have absolutely nothing to do with cognitive decline.
It is a very dangerous trap to default to a cognitive diagnosis without ruling out the physical body first. Nighttime waking might simply be pruritus.
Pruritus. That's the clinical term for severe itching, right?
Yes, intense itching. Just imagine trying to sleep when you feel incredibly itchy all over your body, but you have literally no way to communicate that to anyone.
You're going to pace. You go crazy.
They're going to taste. Or consider that it could be a newly developed noise sensitivity or a phobia. It might be hypertension, so high blood pressure.
Oh, wow. I wouldn't have thought of that.
Right, a dog can't turn to you and say they have a pounding headache from high blood pressure. They just act restless. It could even be something as straightforward as the dog feeling hunger or a sudden urgent need to eliminate because their bladder control is changing as they age.
And then the text brings up this whole category of organopathies, which sounds incredibly serious. What are we actually looking at there?
We are talking about major systemic issues. The waking could be driven by gastrointestinal problems, respiratory issues, endocrine imbalances, or kidney disease.
Okay, kidney disease makes sense.
Right, think about it. It often causes increased thirst, which leads to a full bladder at 2 in the morning. Even adverse effects from a medication they are already taking for an unrelated issue can cause these severe sleep disturbances.
So it's like a domino effect.
Exactly. Now, cognitive decline, like neuronal loss and brain atrophy, is a very real consequence of brain aging. And veterinarians do use validated questionnaires to screen for it. But all of these physical differentials have to be investigated and treated first.
Which makes the veterinary workup so much more complex than just a quick checkup. I mean, they are doing thorough orthopedic and neurological exams.
They aren't just looking at the dog either. They are watching their gait, looking for really subtle shifts in weight, checking eye movements for neurological deficits.
They're running blood pressure checks, complete blood counts, serum chemistry profiles, urinalysis, thyroid screenings. It's a massive list.
It is a massive list.
But what I found so brilliant in the source is this concept of an empiric trial. If I'm understanding this correctly, they don't always need a definitive diagnosis on paper to start treating the dog.
No, they don't. The empiric trial is an incredibly practical clinical tool. Before officially labeling a dog with cognitive decline, a vet might just try treating them for a suspected physical issue to see how the body responds.
So it's kind of like a strategic guess.
Basically, if a senior dog comes in pacing at night, a vet might administer therapies for pain or give them anti-nausea medication. They might even treat them for gastroesophageal reflux.
Essentially canine heartburn.
Exactly. Canine heartburn.
Because if the dog is waking up at night due to silent acid reflux, treating the reflux cures the quote-unquote anxiety. You don't need a brain scan. You just need to settle their stomach.
You treat the hidden physical discomfort, and suddenly the pacing stops completely. The long-term treatment plan is formulated only after you've addressed all those potential physical comorbidities.
That is so practical.
And for really complex cases where multiple physical and neurological issues overlap, bringing in a veterinary specialist becomes incredibly helpful to manage that investigation.
So once we've played detective, right, and we've ruled out the physical pain, the stomach issues, the itching, we have to look at where the dog is actually trying to sleep.
The environment.
Yes, the environment, which brings up this whole fascinating concept of environmental psychology for pets. The clinical recommendations for creating a low-sensory resting area are so specific. We are talking about soft bedding, which is vital for older, achy joints that lack the muscle mass they used to have.
Right.
But there is a very strict clinical warning attached to using low heat, like heated discs or pads.
What's fascinating here is how we have to rethink the physical environment based entirely on the dog's aging sensory perception. You have to be incredibly careful with heating pads to prevent burns.
Because they just might not feel it.
Exactly. An older dog with mobility issues or one experiencing age-related sensory numbness might not physically feel that the pad has gotten too hot, or they simply might not have the mobility to move away from it quickly enough.
That's terrifying. You're trying to help and you accidentally hurt them.
It happens. And beyond temperature, we also have to reconsider lighting. Usually we assume that complete darkness is the ideal sleep environment for everyone.
Right, I need pitch black to sleep.
Most people do. But some older dogs, particularly those experiencing visual or cognitive changes, actually prefer a nightlight. Complete darkness can become profoundly disorienting or frightening when their vision is already failing.
That makes so much sense. If you wake up and you literally can't see your surroundings because your eyes are cloudy, of course you're going to panic.
You'd be terrified.
On the flip side, if the dog is being triggered by shadows or car headlights outside, the recommendation is to use window film or blackout shades to completely eliminate those external visual stimuli.
You really have to tailor it to the specific dog.
Throw in a white noise machine to drown out the neighbor's dog or the garbage truck early in the morning, and maybe some pheromonotherapy to induce relaxation, and you've basically built a sensory deprivation tank for your dog.
It is all about curating that specific environment based on what the individual dog's daily activity pattern tells you. But if we connect this to the bigger picture, though, we have to talk about the other half of this equation.
The humans.
The humans. The physical environment of the dog is only half the battle. The owner's sleep quality is equally critical. The clinical reality is that the owner simply has to get sleep, or the entire caregiving dynamic collapses.
There is a massive emotional hurdle here, though. Imagine looking at your sweet 14-year-old dog who has slept at the foot of your bed for a decade, and you suddenly have to shut the bedroom door in their face because their pacing is ruining your life. The guilt must be absolutely overwhelming for people.
Oh, it's an agonizing decision for a pet owner. But you cannot care for a special needs senior dog if you are chronically sleep deprived. The logistics for managing this are highly practical, though.
What do they suggest?
First, you might try moving the dog's bed closer to the owner. Sometimes just that proximity provides enough comfort to get them to rest. But for others, the owner needs genuine physical and auditory separation just to survive the night.
Assuming the dog's basic needs are met, obviously.
Right.
Like water and a place to go to the bathroom.
Yes, assuming they are safe. Owners might need to utilize closed doors, baby gates, crates, or larger exercise pens.
They even suggest a setup in the source where the dog is kept on a leash, fastened to a back clip harness, never neck collar, obviously, to avoid choking.
Never a neck collar.
Right, and they are tethered to a sturdy piece of furniture, so they literally cannot pace the entire house. But you can't just suddenly tie an anxious senior dog to a sofa at midnight and expect them to be okay with it.
If you try that, you will escalate their panic exponentially. Dogs must be gradually desensitized to these separation arrangements during the day.
So you practice when it's light out and everyone is calm.
Exactly. You might even need to use temporary anti-anxiety medications just to help calm the pet while they're getting used to being physically separated from you at night.
That makes sense.
And to protect the human sanity while the dog is adjusting, it is perfectly acceptable for owners to use noise-blocking devices. Put in earplugs, turn on a loud box fan, do whatever you have to do to muffle the sound of the dog's activity. The human members of the household must be able to sleep.
It is so validating to hear a clinical perspective acknowledge that it is okay to put in earplugs and essentially ignore your dog so you don't lose your mind.
You have to put your own oxygen mask on first.
Absolutely. Now, here's where it gets really interesting. You would think managing nighttime anxiety is all about what you do at bedtime. But a good night's sleep doesn't start at 10 p.m. It actually starts in the late afternoon.
It all comes down to the sleep-wake cycle. When a senior dog's cycle gets inverted, they sleep all day and pace all night.
Like a newborn baby.
Very much like that. To combat this, you have to provide mental and physical stimulation, particularly targeted during the late afternoon or evening hours. This means walks of an appropriate intensity for their age, short training sessions, scent detection games, and food puzzles.
Wait, so if I have a dog that's already exhausted and pacing all night, you're telling me the solution is to make them work for treats at 4 p.m.? How does that not just agitate an already stressed out dog even more?
I know it sounds counterintuitive, but the science behind why this works is twofold. First, the physical and mental exertion naturally tires the dog out, building up their sleep pressure so their body is actually craving rest by bedtime.
Okay, that tracks.
But more importantly, actively interacting with the dog during the day, just talking to them, petting them, giving them a food puzzle, forces them to stay awake. You are actively forcing a reset of that broken sleep-wake cycle by preventing them from napping all afternoon.
You're breaking the cycle.
Yes. Furthermore, mental enrichment actually slows the progression of cognitive decline itself.
That's incredible. Let's talk about the reality of the 3 a.m. wake-up, though. You are exhausted. The dog is panting and clicking their nails on the floor for the 4th hour in a row. The very human, deeply flawed instinct is to just snap and yell, "Go to sleep!" out of pure frustration.
And that is the absolute worst thing you can do. Human responses should never increase distress or inadvertently reinforce unwanted behaviors.
It just makes it worse.
Harsh reprimands at 3 a.m. completely fail. They simply flood the dog's system with more anxiety, which fuels even more pacing. The clinical recommendation is to ignore the unwanted behaviors whenever possible.
Easier said than done at 3 a.m. But instead of yelling, owners can use actual behavioral tools. Like you can practice very short training sessions throughout the day to teach the dog a specific relax cue.
Yes.
If you build that foundation during the calm hours of the afternoon, you can deploy that cue at night when the dog wakes up. Or if you need to physically redirect the dog, you can use a leash connected to a head collar to gently, silently guide the pacing dog back to their bed without saying a word.
But again, the dog has to be acclimated to a head collar during the daytime. You don't want to strap a brand new device onto a dog's face in the dark while they are already having a panic attack.
Yeah, that sounds like a disaster.
That would just be throwing gasoline on a fire. The entire behavioral approach is about quiet, gentle redirection, devoid of any human frustration.
So what does this all mean when the environmental tweaks, the baby gates, and the afternoon puzzle toys just aren't enough? That brings us into the world of medications.
The pharmacological side.
Right. And the host of pharmacologic treatments available is fascinating. But it is vital to understand that pills are not magic bullets. The source explicitly says these medications are fundamentally most effective when they're layered on top of all the environmental and behavioral modifications we just discussed.
And this brings us to a really standout medical strategy. Before a veterinarian puts a senior dog on heavy, psychoactive anti-anxiety medications, they often recommend a 14-day trial of an NSA buy.
Which is a non-steroidal anti-inflammatory drug.
Yes, or another appropriate painkiller.
So instead of just jumping to a heavy psychiatric drug, you basically give them a doggy Advil for 2 weeks to see what happens.
Essentially, yes. This goes back to the empiric trial concept we discussed earlier. You give the dog an analgesic for 2 weeks to definitively prove whether undiagnosed osteoarthritis or joint pain is the real culprit keeping them awake.
That makes total sense. If their hips hurt, they can't sleep.
Exactly. If a simple painkiller stops the midnight pacing, you've instantly ruled out cognitive decline and saved the dog from taking unnecessary psychoactive drugs.
That is such a brilliant, practical approach. But if they do need to move to psychoactive drugs, the nuances in the clinical guidelines are incredible. For instance, There is a major warning about fast-acting sedatives and anxiolytics.
The trial timing.
Yes, you must test these drugs during the day first, when you are awake and available to monitor the dog.
The reason for that daytime trial is crucial. These medications can cause common adverse effects like gastrointestinal upset or a phenomenon called paradoxical excitement.
Paradoxical excitement. So it's like giving a toddler Benadryl, expecting them to sleep, and instead their brain miswires it and they start bouncing off the walls.
That is the perfect analogy. You give the dog a sedative to calm them down, and instead they become intensely agitated and hyperactive.
That sounds awful.
It is. You absolutely do not want to discover that your dog has a paradoxical reaction to a sedative at midnight when you are desperately trying to get some rest. That's why veterinarians advise starting at the absolute low end of the dose range during the day and titrating up slowly to find the effective dose.
The guidelines also get very specific about dangerous drug interactions. Trazodone is a very common serotonin antagonist used for anxiety in dogs. But there is an explicit warning that trazodone should not be used in combination with a drug called selegiline. Can you break down why that is so dangerous?
Yeah. Selegiline is a monoamine oxidase inhibitor, or MAOI. It is an antidepressant often used specifically to treat canine cognitive dysfunction. To understand why mixing them is bad, imagine your brain has a cleanup crew.
Okay, a cleanup crew.
The MAOI basically stops the cleanup crew from sweeping away the happy chemicals like serotonin, so they stay in the brain longer.
Which sounds good on paper.
It is, until you add trazodone, which is also increasing serotonin activity. If you mix the two, the brain gets totally flooded. This creates a high risk for serotonin syndrome, which is a potentially life-threatening condition where the nervous system is completely overwhelmed.
Wow.
Managing the pharmacy of a senior dog requires intense, careful veterinary oversight.
Speaking of the nervous system, there is a truly mind-bending fact regarding benzodiazepines. We are talking about highly common drugs like alprazolam, diazepam, lorazepam.
Yes, the clinical data notes that in geriatric human patients, benzodiazepines have actually been linked to the worsening of dementia symptoms.
Which is terrifying. You take an anti-anxiety med to calm your mind, and it actually accelerates the dementia.
Exactly.
Now, this phenomenon has not yet been formally studied in dogs, but the implication is clearly there for veterinarians to exercise extreme caution when prescribing these for senior pets.
It raises a significant red flag. And veterinarians are equally cautious about another drug called acepromazine.
Oh, the acepromazine warning is chilling. It is explicitly warned against as a solo treatment because it provides chemical restraint with minimal anxiolytic effects.
It's a horrifying experience if you think about it from the dog's perspective. The drug essentially paralyzes the body without calming the mind.
Oh my God.
Right. The dog is still experiencing the internal panic, the confusion, and the anxiety, but they are chemically locked down and physically unable to act on it.
That is awful.
That is why it is absolutely not recommended as a monotherapy for anxiety.
Yeah.
You're one to trap an anxious brain inside a paralyzed body.
It is literally a straitjacket in pill form. Definitely not what we want. Which brings us to the final piece of the clinical toolbox: supplements and diet.
A much safer starting point for many.
Yeah, a lot of owners reach for supplements first because they have a very low risk for adverse effects, either alone or when combined with prescription meds. And the big one everyone immediately thinks of is melatonin.
Melatonin is incredibly popular as a naturally secreted hormone. But there is a vital distinction about its mechanism of action that owners often miss. Melatonin may help the patient fall asleep more quickly, but it does not aid in sleep duration.
It helps them fall asleep, but it won't help them stay asleep. That is such a crucial distinction for an exhausted owner who gives their dog a melatonin gummy, hoping for a full 8 hours of peace, only to have the dog wake up pacing again at 1 a.m.
Exactly, you have to manage those expectations.
Also, from a practical standpoint, the Source Notes owners should only purchase supplement formulations that have their quality control verified by the United States Pharmacopeia, or USP. You want to look for that USP label on the bottle so you know you are actually giving your dog the ingredients listed, especially since empirical research supporting supplements as sleep aids in dogs is somewhat lacking.
However, where we do see some really robust, positive data is in dietary support for the aging brain itself. Products and specific veterinary diets containing high levels of antioxidants and medium-chain triglycerides, or MCTs, can actually improve cognitive performance.
So you can feed their brain.
Yes. Providing targeted brain food is a legitimate, scientifically backed treatment adjunct, regardless of what the primary physical or cognitive diagnosis ends up being.
So we have covered a massive amount of ground here today. We have walked through the comprehensive clinical approach to managing nighttime anxiety in geriatric dogs. We started with the absolute necessity of playing detective diagnosing hidden physical issues like severe itching, hidden arthritis, or acid reflux, rather than just throwing up our hands and assuming it's dementia.
The physical always comes first.
Always. We explored the environmental psychology of the dog's bedroom, from the burn risks of heating pads to the comfort of nightlights, and the vital importance of protecting the owner's sleep with baby gates and earplugs.
Protecting the human is protecting the dog.
Absolutely. We unpacked how making a dog work for treats at 4 p.m. can magically reset a broken sleep-wake cycle, and why losing your temper at 3 a.m. only fuels the fire. And finally, we navigated the complex pharmacy of 14-day pain trials, the terrifying risks of paradoxical excitement and serotonin syndrome, and the cognitive benefits of an antioxidant-rich diet.
As we synthesize all of this clinical data, the most important takeaway for you listening right now is to remember the human-animal bond sitting at the very center of this medical crisis.
It's all about that bond.
Nocturnal anxiety is acutely disruptive. It strains that bond to the absolute breaking point. But the veterinary consensus is clear. With aggressive, multi-layered intervention, immense patience, and realistic expectations discussed openly with your vet, it is possible to restore a normal sleep-wake cycle.
There is hope.
There is definitely hope. You can treat the underlying physical causes, modify the sensory environment, and ultimately restore peace to the household so both you and your dog can finally sleep through the night.
It really is a comprehensive, deeply compassionate approach to the aging process. And as we wrap up this deep dive, I want to leave you with a final lingering thought to explore on your own. We learned today that benzodiazepines might worsen dementia in elderly humans, which is a severe concern we are now projecting onto our aging dogs. If our dogs' aging brains mirror our own so closely that we share the same pharmacological risks, what does managing their nighttime anxiety, perfectly curating your sensory environments, ensuring daytime mental enrichment, and optimizing their diet with antioxidants, teach us about how we should be proactively designing the environments, the routines, and the care structures for our own aging human population?
That is a fascinating question.
Something to really think about. Thanks for joining us, and we'll catch you on the next deep dive.